Hello, this is Dr. Renfro. Let's take a minute to talk about pinched nerves. Pinched nerves are more common than most people believe. What is a pinched nerve? Pinched nerve is a nerve that's under some sort of mechanical pressure or by misplacement of bone or soft tissue. So, bone or soft tissue is literally pressing on a nerve in an unnatural way that's interfering with the function of that nerve. What causes a pinched nerve? There's a variety of causes. It can be acute inflammatory, caused by inflammation or swelling of soft tissues surrounding nerve structures, and that swelling actually causes pressure on the nerve that interferes with the function of the nerve. Structural causes, when we have a change in the structure of the body, it causes the misplacement of tissues, and so we can have bone or soft tissue pressing on a nerve, causing a pinching of the nerve. We also have degenerative causes, and that's similar to structural causes. However, the degenerative is the um, result of long-term structural imbalance that's causing breakdown of the tissues in the body. One thing that most people don't realize is that most pinched nerves do not hurt. Um, Most people that understand that they have a pinched nerve, it's only because they have pain. But what we don't realize is that most of the time a pinched nerve does not have any pain involved with it. One other thing is that pain or no pain, all pinched nerves affect the individual's health in some way. And then the symptoms of the pinched nerve, if there are symptoms that develop, are going to depend on the location and the purpose of that nerve, because not all nerves in the body do the same thing. In fact, every nerve in the body does something completely different within the body. So it has a very specific purpose and pathway. So based on the nerves that are pinched or affected by the misplacement of hard and soft tissue in the body, we have symptoms. So this is just an autonomic nervous system chart that indicates some of the more common symptoms at specific levels of nerve involvement, or pinched nerves at certain levels and what they do. In other words, pinched nerves can cause headaches, migraines, earaches, colds and flu, susceptibility to colds and flu, susceptibility to things like sore throats and sinus, fatigue, definitely vertigo and dizziness, anxiety, depression. Allergies can contribute to allergies over long amounts of time, can contribute to memory loss, the degenerative condition of the nerve structures, including the brain. And then it can cause changes in vision or hearing, things like that. And you just go down the list here and you can see some of these other very common symptoms. It's not a whole cookbook or anything. It's just some of the more common symptoms from nerve pinching at specific levels. What does a pinched nerve look like, and how do we look at it? We look at it using heat sensing technology. This scan on the left would indicate nerve involvement, especially up here at the upper neck region, C1, C2 brainstem region. There's severe, what we might call nerve pinching here. And then we see compensatory stress on the nerves at the lower levels of the spine. This scan on the right indicates a near perfect, which is a nearly perfect nerve scan showing no nerve pinching or misplacement of soft tissue causing stress on the nerves. You have to remember that the spine is supposed to be a very specific shape. When we look at it from front to back, it's supposed to be straight up and down. And when we look at it from the side, we're supposed to have these special curvatures in it, and the curvatures allow it to move normally, move properly, avoid degeneration and damage, avoid the pressure on the nerves, the misplacement of the soft tissues that would cause symptoms, damage, decay over time. Let's look at a quick case study. We have the privilege of being able to help some pediatric patients in the office. This is a 13-year-old young man. Of course, he had multiple pinched nerves in his spine. He did not have any specific pain relating to those pinched nerves. So not all pinched nerves are related to pain. But you can see that the shape of his spine when he came in, which is this film on the left, was considerably the reverse of what it should be. In other words, his neck should be a C curve here, but instead it's a reverse curve here, which means that his spine has flip-flopped, turned inside out, and is going the exact opposite direction of the way that it should. And it's putting a lot of stress on the discs and the soft tissues and the nerves related to this young man's spine. You can see this curvature is negative 25 degrees, whereas it should be about positive 42 degrees. And then after 4 weeks, sorry, 4 weeks of care, over here on this right film, we do a progress assessment to assess what kind of progress we're making with this case. And you can see that his neck is actually starting to go back in the right direction. The C curve is coming back. There's been a reduction in the reverse curvature from negative 25 degrees down to negative 6 degrees. So a change of 19 degrees in this young man's spine and the neck. And if the neck changes like this gives us a cross section or a window into the health of the entire spine. Just looking at the neck alone, if the neck curvature is proper, then the rest of the spine is going to be healthy. But this is a dramatic decrease here in the reverse curvature. So we're moving back the other way. This is probably a little bit faster than what we would say is average. And that's the beautiful thing about kids under care, is that they heal and that they improve so fast, and that with a healthy spine and a healthy nerve system, their potential for normal function and being able to be healthy as possible and to fulfill their ultimate potential is much greater than if there is damage, decay, developing, compression or pinching of the nerves that's interfering with the function of the body. So I hope you've learned a little bit more about pinched nerves today. Thank you.